As we age, many of us begin to notice changes in our bodies that can affect our daily lives, our emotional well-being, and our relationships. These changes, which are a natural part of the aging process, can often stir up a mix of confusion, frustration, and even sadness, particularly when they involve our intimate lives. For many, the realization that their body is no longer functioning in the same way it did in their youth can be disorienting, and it can take a toll on their sense of self-worth and confidence. One of the most commonly discussed, though often uncomfortable issues that many men face as they get older is erectile dysfunction, ED. While it's a condition that affects men of all ages to some degree, it becomes more prevalent as we pass the 50-year mark. The shift in sexual health that many men experience with aging, particularly regarding erectile function, is something that is often not discussed openly, leaving many to feel isolated, ashamed, or unsure of how to address it. However, the more we understand about erectile dysfunction and the factors that contribute to it, the better we are at finding effective ways to manage it, improve our quality of life, and maintain a fulfilling and meaningful intimate relationship. In this detailed exploration, we will dive deep into the causes of erectile dysfunction, not just from a physical perspective, but from an emotional, psychological, and relational viewpoint as well. We'll explore the role of lifestyle changes, medical treatments, and natural approaches to restoring intimacy, and how these can help you maintain your connection with your partner, enhance your self-esteem, and feel more empowered in your sexual health journey. The aging body and its impact on sexual health. Aging is a process that we all go through, but it often feels like an unavoidable series of changes, some of which are deeply personal. One of the most noticeable effects of aging can be on sexual health, which, for many men, involves changes in erectile function. For most men, the idea of aging and experiencing a decline in sexual function can be difficult to come to terms with, as it can feel like a blow to their masculinity and self-image. However, it's crucial to remember that erectile dysfunction is not a reflection of your worth, masculinity, or value as a partner. As we grow older, the body's circulatory system undergoes several changes. These changes are a natural part of aging but can significantly impact erectile health. Achieving and maintaining an erection is dependent on healthy blood flow, which may become compromised with age. Arteries that were once supple and flexible lose their elasticity over time. Additionally, plaque buildup in the arteries, a condition known as atherosclerosis, can narrow the blood vessels and restrict blood flow. This reduction in blood flow makes it more difficult for the penis to receive the oxygen-rich blood it needs to sustain an erection. Beyond these basic physical changes, the presence of certain health conditions that are more common as we age, such as hypertension, high blood pressure, high cholesterol, and diabetes, can further exacerbate erectile dysfunction. For example, men who suffer from high blood pressure are at a significantly higher risk of experiencing ED, as the arteries become less capable of delivering blood to the penis. Research has shown that men with high blood pressure are up to 70% more likely to experience erectile dysfunction compared to those with normal blood pressure. Likewise, diabetes can double the likelihood of developing ED, as high blood sugar levels can damage blood vessels and nerves, making it harder to achieve or maintain an erection. These statistics may seem overwhelming, but it's important to note that erectile dysfunction is not a hopeless condition. In fact, understanding the causes of ED is the first step toward addressing it, and there are many avenues to explore for treatment and management. The psychological impact of erectile dysfunction. While erectile dysfunction is often discussed in terms of physical health, it's also critical to acknowledge its psychological effects. When a man begins to experience ED, it can profoundly affect his confidence, self-esteem, and emotional well-being. The inability to perform sexually can bring about feelings of inadequacy and guilt, which can weigh heavily on a person's sense of self-worth. Additionally, ED can cause anxiety, depression, and frustration, which can further perpetuate the problem. creating a vicious cycle that's difficult to break. The psychological toll of ED can extend to a man's relationship with his partner as well. Intimacy is often a crucial element in relationships, and when one partner begins to struggle with erectile dysfunction, it can create a sense of distance or tension between the couple. This can lead to feelings of loneliness, isolation, and a diminished emotional connection. It's essential to remember that intimacy is about more than just physical acts. It's about emotional closeness, trust, and vulnerability. However, when one partner is struggling with sexual performance, these emotional connections can become strained, which in turn can further exacerbate the condition. One of the most important steps in addressing ED is recognizing the emotional and mental components of the issue. Speaking openly about the condition with your partner is vital. Sharing your feelings, concerns, and frustrations can foster greater understanding, reduce the stigma surrounding the condition, and create a supportive environment for both individuals in the relationship. Lifestyle changes to improve erectile function. The good news is that there are numerous lifestyle changes that can help improve erectile function and sexual health as we age. While medical treatments and interventions are often necessary, adopting a healthier lifestyle can significantly improve overall vascular health, reduce the risk of developing other health conditions, and restore intimacy in your relationship. Exercise. The key to better circulation and health. Regular physical activity is one of the most effective ways to improve circulation, boost heart health, and lower the risk of conditions such as high blood pressure and diabetes. Exercise strengthens the heart, improves blood flow throughout the body, and helps maintain healthy body weight, all of which contribute to better erectile function. Research has shown that men who engage in regular aerobic exercise, such as walking, jogging, or swimming, are less likely to experience erectile dysfunction. In fact, studies have shown that physical activity can enhance erectile function in men, even in those who are already struggling with ED. Diet, fueling your body for optimal health. A nutritious diet plays a vital role in maintaining sexual health. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports overall vascular health and helps reduce the risk of conditions that contribute to erectile dysfunction. For example, incorporating foods high in antioxidants, such as berries, spinach, and dark chocolate, can help protect blood vessels and improve circulation. Additionally, foods like nuts, seeds, and fatty fish, such as salmon and mackerel, are high in omega-3 fatty acids, which can reduce inflammation and improve cardiovascular health. It's also important to reduce the intake of processed foods, refined sugars, and unhealthy fats, which can contribute to weight gain, high cholesterol, and other conditions that exacerbate ED. Reducing stress. The mental health connection. Stress and anxiety are major contributors to erectile dysfunction. The mental and emotional toll of stress can hinder a man's ability to relax and focus during intimate moments, making it more difficult to perform sexually. Moreover, chronic stress can lead to hormonal imbalances, particularly a reduction in testosterone levels, which can further contribute to sexual dysfunction. To combat stress, it's crucial to engage in stress-reducing activities such as meditation, mindfulness, yoga, or simply spending time in nature. These practices can help calm the mind, reduce anxiety, and improve mental clarity. Additionally, taking time to engage in activities that bring joy and fulfillment can help alleviate emotional strain and improve overall well-being. The importance of communication in relationships. As ED can take a toll on relationships, open and honest communication between partners is key. When both individuals in the relationship are able to talk openly about their concerns, desires, and emotions, it creates a safe space for intimacy to thrive. While it can be uncomfortable at first, addressing the issue together can lead to a deeper emotional connection and a renewed sense of closeness. Intimacy doesn't have to be defined solely by physical intercourse. Over time, as we age, many couples find that their emotional connection deepens and their intimacy takes on new forms. Affection, shared experiences, and emotional support become just as important, if not more so, than physical acts of love. Exploring different ways of expressing affection, such as holding hands, cuddling, or sharing intimate conversations, can help preserve the closeness and bond in a relationship. Medical treatments for erectile dysfunction. In addition to lifestyle changes, medical treatments have made great strides in recent years, offering numerous options for men struggling with erectile dysfunction. Oral medications, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are commonly prescribed to help improve blood flow to the penis and assist in achieving an erection. While these medications are effective for many men, they are not suitable for everyone, and there can be side effects. Other treatments for ED include hormone replacement therapy for men with low testosterone levels, penile injections, vacuum erection devices, and even surgical interventions like penile implants. It's essential to consult with a healthcare provider to determine the best course of action based on your individual health and needs. The complexity of erectile dysfunction in aging. As we navigate the course of our lives, many of us experience changes in various aspects of our physical, emotional, and psychological health. These changes are a natural part of aging, but one of the most challenging and often overlooked transformations is in our intimate lives. For men, one of the most common issues they may face as they age is erectile dysfunction, ED. This condition, which refers to the inability to achieve or maintain an erection firm enough for sexual activity, affects millions of men, particularly those over the age of 50. While it is a deeply personal and often difficult subject to address, ED is far more common than many might think. In fact, it is estimated that nearly half of men over the age of 50 experience some form of erectile dysfunction, making it a widespread issue that is too often shrouded in stigma and silence. Erectile dysfunction is not merely a physical ailment. It is a complex interplay of various factors that include physical health, psychological well-being, emotional connections, and societal pressures. As men grow older, the body undergoes numerous changes that can impact sexual function. Hormonal fluctuations, decreased circulation, and the onset of chronic conditions such as high blood pressure, diabetes, and cardiovascular disease can contribute to the development of ED. However, it is essential to recognize that ED is not just a result of aging. It is often a symptom of deeper health concerns that require attention and understanding. In this article, we will explore the multiple facets of erectile dysfunction in aging men. We will discuss its physical causes, the psychological and emotional effects it has on both the individual and their partner, and how societal expectations and myths contribute to the stress surrounding this issue. Moreover, we will delve into effective lifestyle changes, medical treatments, and natural approaches that can help men improve their sexual health and maintain fulfilling intimate relationships as they age. Whether you are personally affected by ED or seeking to support a loved one, this comprehensive guide will provide valuable insights and practical advice. The physical causes of erectile dysfunction. To understand erectile dysfunction, it is crucial to first examine its physical causes. One of the most significant factors contributing to ED is the decline in blood circulation that occurs with age. The process of achieving and maintaining an erection is reliant on healthy blood flow. When a man becomes sexually aroused, the brain sends signals to the blood vessels in the penis, causing them to relax and dilate, allowing blood to flow into the penile tissue. The increased blood volume results in an erection. As men age, however, the blood vessels can become less elastic, and the arteries may narrow due to the buildup of plaque or fatty deposits, a condition known as atherosclerosis. These changes make it more difficult for blood to flow freely into the penis, leading to difficulty in achieving or maintaining an erection. Conditions such as high blood pressure, hypertension, high cholesterol, and diabetes can exacerbate these issues as they further damage the blood vessels and contribute to poor circulation. Studies have shown that men with high blood pressure are up to 70% more likely to experience erectile dysfunction than those with normal blood pressure. Similarly, men with diabetes are twice as likely to experience ED compared to those without the condition. These physical conditions can significantly impact a man's ability to achieve an erection, creating frustration, feelings of inadequacy, and a diminished sense of self-worth. While these physical changes are a natural part of aging, they do not have to be accepted without intervention. There are steps that men can take to manage their health, improve circulation, and reduce the impact of these conditions on their sexual health. In addition to cardiovascular health, hormonal changes also play a role in erectile dysfunction. Testosterone, the primary male sex hormone, declines gradually as men age. This decrease in testosterone levels can lead to a reduction in libido, lower energy levels, and increased difficulty in responding to sexual stimuli. While not every man will experience a dramatic drop in testosterone, those who do may find that it affects their sexual desire and performance. This hormonal shift, coupled with the other physical changes associated with aging, can create a perfect storm of factors contributing to ED. Psychological and emotional factors. The mental battle of ED. While the physical causes of erectile dysfunction are important to understand, the psychological and emotional impact of ED cannot be overlooked. Erectile dysfunction is not just a physical issue, it is also a mental and emotional challenge that can affect a man's self-esteem, confidence, and sense of identity. Many men who experience ED feel embarrassed, ashamed, and even frustrated by their inability to perform in the way they once did. These feelings can lead to stress, anxiety, and depression, which in turn can exacerbate the problem. One of the most common psychological factors contributing to ED is performance anxiety. The fear of not being able to satisfy one's partner or meet societal expectations can create immense pressure. As a result, the anxiety surrounding sexual performance can prevent a man from being able to relax and enjoy intimacy. This creates a vicious cycle. The more anxious a man becomes about his performance, the more likely he is to experience erectile difficulties, which then intensifies his anxiety and self-doubt. Additionally, depression can also play a significant role in the development of ED. Men who are dealing with depression may experience a diminished interest in sex, lower energy levels, and difficulty achieving an erection. This emotional and mental health condition can create a sense of hopelessness, further fueling the problem. It's important to recognize that mental health and sexual health are closely intertwined, and addressing one can have a positive effect on the other. Furthermore, relationship dynamics can contribute to the psychological toll of ED. Intimacy is not just about physical pleasure, it is also about emotional connection, trust, and vulnerability. When erectile dysfunction occurs, it can strain the emotional bond between partners, leading to frustration, disappointment, and a lack of communication. The fear of disappointing a partner can create emotional distance, which only further complicates the issue. Societal pressures and myths about male intimacy. One of the most insidious factors contributing to erectile dysfunction is the societal pressure that men face regarding their sexual performance. There is a deeply ingrained myth in many cultures that male intimacy is synonymous with an erection, and that a man's value or masculinity is directly tied to his ability to perform sexually. This expectation creates tremendous pressure, leading many men to feel inadequate or ashamed when they experience erectile dysfunction. This belief is not only harmful, but also misleading. Intimacy is not solely about the physical act of sex. It is about the emotional connection, the shared experiences, and the love that exists between partners. This myth also affects women, as they may feel frustrated or unsure about how to navigate the changes in their partner's sexual health. For both partners, understanding that intimacy evolves with age and that sexual pleasure can take many forms is key to maintaining a fulfilling relationship. The focus should shift away from performance and towards emotional connection, tenderness, and affection. Effective solutions, lifestyle changes, and medical interventions. Fortunately, there are many solutions available to help men navigate erectile dysfunction and improve their sexual health. One of the most powerful tools at a man's disposal is lifestyle changes. Engaging in regular physical activity, such as walking, swimming, or practicing yoga, can improve circulation, promote cardiovascular health, and reduce stress, all of which are essential for healthy sexual function. Exercise also boosts mood and alleviates anxiety, which can be particularly helpful for men dealing with the psychological aspects of ED. A well-balanced diet rich in fruits, vegetables, whole grains, and healthy fats can support heart health and reduce the risk of conditions like high cholesterol and diabetes, which contribute to ED. Smoking cessation and moderation in alcohol consumption are also vital. Smoking damages blood vessels, which directly impacts circulation, while excessive alcohol can numb the nervous system, hindering sexual response. In addition to lifestyle changes, medical treatments are available to help manage erectile dysfunction. Medications like sildenafil, commonly known as Viagra, can improve blood flow to the genital area, helping men achieve and maintain an erection. However, these medications must be prescribed by a doctor and come with potential side effects, including headaches, dizziness, and digestive issues. For men with specific health conditions, such as heart disease or high blood pressure, these medications may not be suitable. It is important to consult a healthcare provider to determine the best treatment plan. Another medical option is hormone replacement therapy, HRT, for men with low testosterone levels. Testosterone plays a key role in sexual function, energy levels, and mood, and supplementing it can help address some of the symptoms of ED. However, HRT must be carefully monitored, as improper hormone levels can lead to other health issues. Beyond medical treatments, communication is one of the most effective tools in managing erectile dysfunction. Open, honest conversations with a partner can reduce stress and help both partners understand each other's needs and concerns. Redefining intimacy, focusing on emotional connection rather than performance, can lead to a more fulfilling sexual relationship. Conclusion: redefining intimacy in later life. Erectile dysfunction is a common and natural part of the aging process for many men, but it does not have to be a source of shame or despair. By addressing the physical, emotional, and psychological factors that contribute to ED, men can regain control of their sexual health and continue to experience intimacy in meaningful ways. Lifestyle changes, medical interventions, and open communication with a partner can help restore confidence and strengthen relationships. As we age, intimacy may evolve, but it can be just as fulfilling, if not more so, than it was in younger years. The key is to embrace these changes with an open mind and a positive attitude, focusing on the emotional bond and shared experiences that form the foundation of a strong and lasting relationship. Sexual health is an integral part of overall well-being, and with the right approach, men can continue to enjoy a rich and satisfying intimate life well into their later years.